when you mention program design, I mean, at the most fundamental level, you're talking about what activities you're doing, the intensity you're doing them at, how frequently you're doing them, that sort of thing.
Yeah, absolutely. And hey, the beginning of program design is simply sitting down and writing what are your goals. I
Yeah.
think that's oftentimes something that's skipped or not taken seriously. Is well, what makes some objective, measurable goals. Maybe they're 6 week or 6 month goals. Making sure that you have a nice objective measure is the first aspect, and setting some goals, and then you come behind that with intensity, frequency, the modes of exercise, and you design, loosely design a program for yourself. And, obviously you'll need some guidance on that, and you'll consult with your colleagues and your coaches and so forth, and try to make it realistic. That's another thing, as I think folks spend a lot of time, those who get really into program design and are more of the calculated mathematical type folks, want to plan out for 6 months or a year, or so on. I mean, really, that's just for I think the most extreme elite cases. You have a general guideline, or kind of a schematic of your goals, and how long you want to work towards those goals, and I think that you follow it the best that you can, but understanding that reality is always the ultimate in program design, and that logistically being realistic with your program, and understand that hey, you have a goal set, you do your best to follow your program, but it still needs to be flexible.
I think those are all good points, and certainly anyone who has ventured into climbing training has come up against the issue that you have all these other things going on in your life, and the amount of time you have to train is limited, and not everyone can be the top 1/10 1% mathematical focused, planning everything out for a year. Let's talk about recovery from injury a little bit, since that's what you do in your practice. There's a lot of what I would say. There's a lot of conventional wisdom in the climbing world about how to recover from an injury, and maybe I could throw out a couple of things that I often hear people say, and you can comment. Like, I think the big one is that a climber will get an injury to the hand or finger, and they'll take time off, and they won't climb for a month, and then they'll come back to the gym, and they'll feel pain, and they'll say, well, I took a month off. Why am I in pain?
Sure. An injury, and exactly what's going on. Obviously, if it's serious, again, I have to recommend that you seek medical attention, for obvious reasons. But if it's more of a minor injury, it's still, all injuries still fall under the same tissue healing process. And no matter how severe it is, and even if it's a traumatic event on the wall, or if it's a traumatic event in the operating room, it's still a traumatic event. And so your body has got to take time to heal and to mend itself. But during the rehabilitation process, hopefully your rehabilitation professional is going to begin applying stresses in somewhat of a linear fashion, to increase the tensile strength of whatever tissue that's been disrupted. And so looking at doing that in a very sequential, systematic way is really what needs to be done. And so that's oftentimes what happens with the amateur athlete or the recreational athlete is you have a traumatic event, you maybe have some bleeding and some a lot of pain, and so then it's like, well, I'm not going to do that again, and you take a break and you don't come back to the wall for 6 weeks or 2 months, and your function in your hand might be fine. You might have what you consider to be full range of motion and so forth, and so you feel like you're ready to go back on that wall. But understand that during that 6 weeks or 2 months, hypothetically speaking, that all that time you've been detraining, and so that tendon strength, that ligament strength, the muscle strength, all those concepts that we've already discussed, that's all decreased. And so we're back to a program design issue of, well, how much stress can you tolerate? And I think the best guide is really pain. It's pain. If you're having pain during your activity, you need to stop. And taking short, kind of small chunks at a time, because the muscle soreness, after that first climb back is going to be severe. And so, not kind of having this hit or miss program, but rather, sticking to it and saying, look, I'm going to spend 45 minutes on the wall today, and I'm going to do that twice this week, and next week I'm going to spend an hour twice, and having a nice linear progression to that. But when it comes to injuries, there's really a kind of a universal process that occurs, and it doesn't matter if it's a tendonitis, which is really an abused term. Itis it means inflammation. You know what tendon is, and so if you've had a tendonitis for more than a few weeks, then it's really not a tendonitis anymore. It's a tendinosis, which is a chronic example of a tendonitis. Or if you've had a ligament injury, or if you've broken a bone or torn a muscle, the same process really occurs. First off, you have to wait until everything's healed. If the fracture, isn't healed, then you really can't put weight through it. If the muscle belly isn't healed, if it isn't scarred down, then you can't use it yet. But once the tissue is healed, then it's about restoring full range of motion, and that's critical. You want to have as much range of motion on one side as you do the other. And so once the range of motion is returned, then you're looking at building back strength, and that's the process by which really all injuries are at least orthopedic and sports medicine type injuries are approached. Once strength comes back in an isolated fashion, then you look to integrate that back into its kinetic chain. So if that's an elbow or a hand, making sure that hand can work with its neighbors, with the rest of the upper extremity.
That's a really good way to put it, and I think that's something that we tend not to think about. Or the couple things we tend not to think about, one of them being that we're integrating, the injured finger or whatever back into a whole, and also the idea that we have to progress linearly after having detrained something for such a long time. Then it's a linear progression back to where you were previously. I guess the question that people are going to have, and I know you probably won't have an answer for this, is they're going to know about intensity level. Like, I came back from a finger injury. How hard can I climb?
It depends on the level of the athlete prior to injury, and it depends on what their measure of intensity is.
Let me just throw something out, like icing. Like, how important is an activity such as using heat or cold in recovering from muscular or tendon injuries?
I think those modalities are incredibly important. And looking, the old acronym of PRICE, rest, ice, compression, elevation, and then looking at, well, how important is those modalities? Well, absolutely. I mean, I use them every day, and I think ice in particular is a great modality for the culture of climbing, because not only does it reduce any kind of inflammation, and I know that the times that I've been climbing, I feel when I get off the wall and I kind of head home, my hands have had they're so well, first off, kind of engorged with blood and swollen, but also they're almost hypersensitive. I don't want to touch anything, especially anything that's not that's kind of rough, because my nervous system has really gotten excited, and the somatosensory homunculus in my brain, my hands are very large and very my brain is very focused on them, and so to try to not only decrease inflammation or swelling in the area, but also as a pain control technique, because my nervous system is going to get distracted by that decrease in temperature, and so I'd much rather feel cold than to feel pain. And so the numbing effect of ice is extremely valuable, and I use that on a daily basis. And actually, there's been some research as of late looking at the use of ice to increase muscle contraction. So perhaps just as a regeneration technique, after a hard climb, if you know you're going to be climbing later that evening or perhaps early the next morning, that would be one of the things that I would recommend. Is to ice down, the hands or elbows or shoulders or whatever's bothering you. There's a reason why after a football game, those NFL players get into an ice bath because
Right.
their entire body, is inflamed and swollen, and they're trying to make it to the next game and survive.
I do want to emphasize one thing you said, because it sounded like what you were saying is that you ice just to decrease inflammation after a workout. Like, you don't even have to be injured to benefit from icing.
Yeah, absolutely. Yeah, without question. Yeah.
I mean, I think your description of what your fingers feel like after a hard climbing workout, any of our listeners are going to be able to empathize with the sausage finger feeling.
Right, right.
And so the way to deal with the sausage fingers is to get some ice on them.
Yeah, yeah. Or even if you just after you're done your climb, you take a real cold shower, or you wash your hands in real cold water. I mean, anything like that where you're going to cause a temperature gradient, and you're gonna change the amount of fluid in the fingers and hands. I think that's a good thing.